Hi, Einav.
It's been a while, Miri.
It has been a while, Einav. That was like the up and plus side of everything happening. זה באמת להתחבר לאנשים מהעבר.
ממש, ממש ככה, אתה יודע, ברגע שאתה תראו על people are still joining us, so let's say that in about 3 or 4 minutes we'll start. Bear with us.
עיניו עברנו את ה-30, נראה לי אפשר להתחיל, לא?
כן. So we'll start then. Again, good evening or good afternoon, wherever you are around the globe. I know that we have some friends from the East Coast that join us just during their workday. My name is Enav, and I would like to welcome all of you to our lecture that will be given by Miri Eisen, which I'll present soon. This lecture is part of a webinar that discuss few topics from a varied angles, of course related to the coronavirus and the times we are all facing these days around the globe dealing with this crisis. This series of webinars is part of collaboration between few organizations, Natan for International Humanitarian Action, Pierce Foundation, SID for Society of International Development, the program in Tel Aviv University of Emergency and Situation Management in Emergency Situation, Olam, Masha, which is the Israeli Agency for Development, and Forum Dvora, which, if I may ask Tanya, their CEO, to present this forum, because our lecture this evening is part of this forum. Tanya, would you like to say a few things about the forum?
Sure, thank you, Einav. Okay, so Forum Dvora is an Israeli NGO promoting women in foreign policy and national security. We're nonpartisan, and our participants come from a variety of backgrounds. We work towards the equal representation of women in decision-making positions within the security and policy-related fields, in the media, in the academy, in academic fields, and in professional panels. We aim to broaden the topics defined as national security and diversify the participants. Miri is one of the founding members of Forum Dvora, so it's an honor to have her here with us, and I'm really looking forward to hearing her speak. Thank you, Einav, and it's been really interesting so far. Over to you.
Thank you. Before we start, I would like to emphasize that this lecture is recorded. So after the lecture, will circulate it around through the social media of the organizations who are taking part in this initiative. And I encourage you to send it over and publish it all over your social network. Few words about Miri. Before I'll share her, no, you know what? I'll start with a bio, then I'll tell you a small secret. So Miri, which we'll discuss soon about the Middle East in the age of coronavirus, unity and cooperation. Miri serves currently on the faculty of the Interdisciplinary Center in the IDC in Herzliya, Israel, where she teaches graduate and other graduate students and is an associate at the International Institute for Counterterrorism. Miri has a deep background in intelligence, security, and diplomacy. During her 20 years in the Israeli Defense Force, Miri serves as the intelligence officer in combat unit's personal assistant to the director of military intelligence and deputy head of the Combat Intelligence Corps. I think is among the first women to achieve the rank of colonel in the IDF. After retiring from the military, Eisen served as the Israeli government spokesperson during the Second Lebanon War in 2006 and as the international press secretary to Prime Minister Ehud Olmert during the Annapolis peace process of 2007. Miri is one of the founding members of Forum Dvora, as Tanya just told you, which is the organization Women in Foreign Policy and National Security. Now, the secrets that I wanted to share with you, that I know Miri for more than 18 years. I had a really privilege and to work under her in one of our mutual military service. And we just, before we started, we just shared a few memories together. So without further ado, Miri, there you go. You are welcome to start. And for you guys, if you have questions during Miri's lecture, just write it on the right-hand side of the chat, and Miri will refer to it. And after Miri will finish to talk in about 30 minutes, you'll have the option to ask questions through the mic or through the chat, and then Miri will refer to all of your questions. Miri, the floor is yours.
Thank you so much, Einav. Thank you so much, Tanya. I really appreciate this opportunity to be able to talk to a very diverse audience. So, ladies and gentlemen, it's April 20th. I need to say that again. It's April 20th. We're deep into a new era. I don't think that any of us can really understand what it's going to look like this summer, let alone 2021. And what I want to try and do over the next 30 minutes is to try and talk about COVID-19, the virus, the pandemic that we're all living through here in the Middle East. And I want to talk about it as a driving factor here and now. Obviously, it's impacting all of us. To do so, what I want to do is I'm going to be presenting a little bit about the Middle East in general. I'm going to talk about some of the driving factors that were here before the virus hit, and we're going to talk about how they are going to impact now that the virus is here. So to do so, I am going to share screen and show some maps. I'm a map person, that's my background, and I always prefer it that way. The maps themselves, none of them are really important. It's to keep me on subject and to give you something to look at, because at the end, we're all sitting inside our houses. So from inside your house into my house, I live on that map, meaning I live somewhere on the Mediterranean Sea. And as you look at that map of the Middle East right now, I want to remind you that the Middle East, when we talk about it, it depends how we define what we talk about. So I want to be very clear and say, I am talking about the Middle East that includes the Middle East and North Africa. Meaning map-wise, I'm talking about countries that go all the way from Morocco, certainly to Iran. I'm not even going to stop. I'm going to go on Afghanistan, Pakistan, not because they're part of the Middle East, but what I'm going to be talking about will certainly be impacting them also. So if I give that definition of the Middle East that I'm going to be talking about right now, I want to remind you, as I started, is that it's April 20th, which to me is kind of flabbergasting. Because remind yourselves for a moment where we were in January. In January, we were all all about. Hashtag World War III, hashtag bring back, are they going to bring back the draft? What is happening between Iran and the United States? I remind you, the assassination, the killing of Qasem Soleimani. You can see his photograph at the bottom portion. The big picture is at the funeral. That was in January. Okay, so that seems like a long time ago, but still in January, we got this. We had the presentation of a vision, of a booklet. It's 181 pages. Any of you can download it, and you can read about a vision which has in its title a term that we don't always use here in Israel called Palestine, or a future state of Palestine. And that also happened just a few months ago. And I'm in Israel. I mean, are you kidding me? This happened on March 2nd. So we're on April 20th. In Israel, we still don't have a government. We had our third elections in less than a year on March 2nd. And all of that was before coronavirus became everywhere. So I just give you that in the background to remind you that there were things going on here before the pandemic hit. And I'm saying that because what I want to present to you right now is an idea. Perhaps it's a framework to look at the day after, because the day after of this pandemic is very much impacted in any of the places in the world, but also in the Middle East, by what was here the day before. Which means that I'm going to take a few minutes right now to talk about several driving factors in the Middle East today and how these driving factors step into the pandemic world, are impacted by it, and will impact the way that these different countries associate with it. So where are we until now? I define the Middle East as being Middle East and North Africa in a very broad way. I reminded everybody that there are a few things that were happening before this started. And what I want to offer you right now is a framework to look at the Middle East 2020 to understand the impact of the pandemic, which is different in every country. So I'm going to offer you now a few driving forces. Driving force number one. And thank you. Driving force number one that I'm going to be talking about is demographics. When I say demographics, and I'm talking right now in 2020, I'm talking right now in a world that we all know, when you look at the numbers of the amount of people in the Middle Eastern countries, that's not the big issue. Lots of countries are bigger. You can see that Egypt, or for that matter, Turkey and Iran are in the top 20 largest countries in the world. That's big. But the issue that is unique to the Middle East and North Africa and to other countries, but in this case, I'm going to be emphasizing it, is the enormous youth population. Why does that matter so much? If you look at the countries now from Morocco through Iran, every single one of those countries, without any exception, except for Israel, and we're plop in the middle of the Middle East, all of those countries, half the population is under the age of 25. Half the population under the age of 25. Think about what that means when it comes to governance, building schools, how you contend with jobs, with housing units. But the big things that I want to talk about are two. One is that together with this enormous half the population under the age of 25, the populations here, that percentage of the 15 to 24-year-olds, which is enormous in all of these countries, are also, before coronavirus hit, the enormous unemployed. Do you understand how negative that is? We all understand the impact of what's happening in the economies. It's happening in the Middle East and North Africa too. Those same populations that already could not find jobs are going to find it even that much harder. So that is a very negative aspect that we're all going to have to look at, because they have such enormous youth populations that were already unemployed. But there is a flip side to that. And the flip side to that is, without you getting into the numbers, and I'll just say now, anybody who wants the presentation, afterwards you can ask and we'll be able to send it to you. I steal my slides from anybody who is willing to let me take them online. You can have them too. And when you look at these, the World Health Organization, who've been a lot in the news in the last month, or 6 weeks, and the World Health Organization looks at what they call the Eastern Mediterranean. And without getting into the detailed numbers, the bottom line is that relatively, everything is relative, they're not having a lot of deaths. They're not even having a lot of people infected. And that directly has to do with what I just presented before, that they have enormous youth populations. And all of us have already understood that in this pandemic, for a variety of reasons, it's hurting older people more than the younger generation. I don't know if that's going to change. I'm talking about it from a geopolitical point of view, but for right now, on the one hand, there's going to be more unemployment for these people, and that's a direct impact. And on the other hand, there are actually, percentage-wise, much less deaths than there are, for example, in Europe. So that was the first element that I said is a driving force, which is demographics, and overwhelmingly I emphasize the youth demographics. Let's go to driving force number 2. So you're all looking at this right now and thinking about it, and I'm going, wow. Do you guys know it's April? We all here in Israel, all of us 9 million, all of the 7 million more or less Jews that are in Israel of 9 million citizens, we just went through Passover. If you're here, if you're overseas, if right now you're in the United States or anywhere in Europe, anybody who is a Jew had to go through this very different Passover. Wow, was it different? The Zoom Passover, which I myself did with my family, the fact that the Western Wall is empty and you're not allowed to go there, the way that we prepared ourselves, we're all aware of that. And I go, I want to be very straight, okay? Less than 15 million Jews in the world. We're not over with our Jewish holidays. Boy, does it impact Judaism. Don't you agree? And then I go, wow, you know what's been happening over the last 2 weeks? In the last 2 weeks, we've all been following the issue of how this virus is impacting Christians. And it doesn't matter if it's Catholics and Easter that was last week, or if it's the Orthodox Church and Easter that was this week, and these extraordinary Easters. And I want to remind you that for some, like the Holy Fire Ceremony, starts in the Church of the Holy Sepulchre in Jerusalem, the capital of Israel. Is that East Jerusalem? Is it occupied Jerusalem? Suddenly, it's an event which is religious, but it's important for 2 billion Christians the whole week of Easter. And we are all focused on that. And I offer you driving force number 2. It's not necessarily about Jews. It's not necessarily about Christians, ladies and gentlemen, it's about Muslims. When we talk right now about the world, and this is a general one, most people aren't aware of the fact that the bulk of the largest Muslim countries in the world are in Asia. Indonesia, Pakistan, Bangladesh, and India are the 4 most inhabited Muslim countries with the largest Muslim populations. Nigeria in Africa is the 5th, and only then do you arrive at Egypt. And I say that, sorry, because when we go to the Middle East of today, the Middle East, as you all kind of know from our stereotypes, is overwhelmingly Muslim, Muslim Shiite, Muslim Sunni, but I'm not going into those. I'm just talking about Muslim right now, and I'm talking about COVID-19. And I'm going to ask all of the audience here to think to yourselves right now, I went through Passover, perhaps you went through Passover or Easter, perhaps some of you are Muslim or from other religions. But ladies and gentlemen, do you guys know what's happening on Friday? Ramadan Kareem, Ramadan, or the holy month of Ramadan, the month of fasting, is going to impact horrendously from Morocco through, in this case, I would say in Indonesia, as I said, I put that broader map, these countries that are 95% Muslim, and they are supposed to fast during the day. But the term that most of you are not necessarily familiar with is the term of iftar. Iftar is the evening when you break fast. I'll put it otherwise. I'm a Jew. For us Jews, when we fast, it's all about the fast. In Islam, they fast, and it's all about the break fast. And in a beautiful way, during the month of Ramadan, that's the month when you have every single, for 30 days, 30 nights, you're together with family, you are eating, you're doing things. What are they going to do during Ramadan? Oh, let's take this another step further. What are they going to do with Al-Aqsa? The picture that we're seeing right now is of the Dome of the Rock, not the Al-Aqsa Mosque. The area, the compound, is the Al-Aqsa compound. The Al-Aqsa compound has been closed by the Jerusalem Islamic Waqf, not by Israel, but we're the ones who implement it. So a Muslim comes to pray at the holy site at the Al-Aqsa compound. They arrive at the door. The Jerusalem Waqf have already said, the Islamic Waqf, those are the religious authorities, that they are not going to allow anybody up there. It's dangerous. But what if you get somebody who comes up and wants to go in? The police officer who will stop him from going in is going to be Israeli. So suddenly I have COVID-19 connected into holy sites, connected into religion, connected into geopolitics, and this is still in front of us. It's not one Friday, it's 4 Fridays. It's not one day of fast, it is 30 days of fast. It's the combination of how are they going to stop contain the infection, not the infection, the pandemic from spreading on the one hand, the way that in Israel, they made us all stay home at Passover, not have Passover with our only with our immediate families, whoever's in the house. We all did these Zoom seders. What's the Muslim world going to do with that? And this is an enormous challenge. So I showed you Jerusalem. Just go a step further. This is impacting the holiest sites for Islam. The 3 holy cities, Mecca and Medina in Saudi Arabia, Jerusalem that I showed you just before, and the holiest site, which is an integral part of Islamic prayer, and it's going to impact the entire Islamic world. As I said, 5 largest country, not in the Middle East, but after that, Morocco, Algeria, Tunisia, Libya, and Egypt and Sudan, cut across Saudi Arabia, Iraq, Syria. Need I go on? Let alone Hajj, the Hajj this year, which is an additional ceremony. It's one of the 5 pillars of Islam, takes place at the end of July. I don't know what's going to be at the end of July, but think of the implications for religions, and specifically in the Middle East, for all of the challenging aspects that we've had. And I take that into an additional aspect, which is the Syrian war. So if I look right now and zoom out of these cases of COVID-19, Iran has been the country in the Middle East that has had the largest, significantly most amount of deaths. And right now it's connected directly to a holy city in Iran where they did not close it off. And just think about all of the people coming up. I want to like touch my screen right now, touching, kissing, doing, things that people do in holy sites. And these are challenges worldwide. They don't have to do with geopolitics, and yet they do. Because when I look a step further, from Iran, that has been the center of the strongest outbreak within the Middle East, I immediately skip over to Syria. Syria has been in a war for the last 10 years. Syria has been in a war that is both a civil war inside the perimeter of the lines of the country that we used to call Syria. It's also a proxy war. It's also a religious war, Sunni Shiite. It has Russians, Turks, Iranians. It literally has Muslims from all of the world all over. And in a way, for us, for most of us, pre the pandemic, this was the biggest challenge inside the Middle East, the implications of what it did. And I want to take some of this issue of the Syria war, which is not over, and it's continuing in the pandemic, and the battles are going on during the pandemic. They haven't stopped because of the pandemic. And to take it into the challenges as we look forward into the geopolitics of the Middle East. Syria, in the last 10 years, has supplied, isn't that a terrible way to put it? Has made, that's also a terrible way, every single person is a person, the largest humanitarian disaster since World War II. In the numbers themselves, there are almost 6 million Syrians who have left and are in refugee camps. And the largest number is in Turkey. And after that, you can see in Lebanon and in Jordan and even in Iraq or in Egypt, let alone the flow that went into Europe in 2015, 16, and then Europe kind of closed the doors. And I say that in the background because in its own way, you go, this was here before. The world was not taking care of it before. This was perceived as this enormous challenge before. But think about what it means in the COVID-19 world. It spreads faster in densely populated areas. Could there be more densely populated areas than refugee camps in all these places where you have millions of people? 74 million people in the Arab world lack hand washing facilities. I took that off of the Associated Press just over the last few days because we don't think about the practicalities. And the practicalities when we're talking about that are not just the millions of Syrian refugees, the millions of internally displaced Syrians. This is something way broader, and it's something that we need to be aware of. It is a horrific, it's going to explode. Okay, so that's one aspect, the humanitarian aspect, that again, the Syrian war is not over. The battles are still going on. Oh my God, how horrific for the humanitarian disaster. But I want to keep going because we talk about the Islamic State. And one of the things that happened over the last 10 years was the rise of the Islamic State, it taking out very large tracts of land in Syria and in Iraq, the world coming out and saying, oh my God, this is the worst thing ever. And it shrunk, and everybody went, isn't that better? We're all against the Islamic State, I should hope. Okay, really, talk about a perversion. And I have some bad news for all of us, because when it shrunk, it never disappeared. And under the COVID-19, but not just because of it never disappeared. And contrary to what leaders worldwide have said, it may have been physically destroyed, but it was never destroyed ideologically. And it always had last areas. And what can I tell you? It's raising its head. It's raising its head inside Syria, in areas that are in the middle of the desert. You go, okay, that's not good news. But it's raising its head worldwide, meaning the physical provinces that used to exist and were very strong in Syria and Iraq and were destroyed, those haven't yet really resurrected. But we have provinces nowadays all throughout Africa, out in Asia, and the COVID-19 has not stopped them. Those are things that are continuing to happen all the time. So look at where we've been. We have an enormous young demographic. We have a very strong impetus and important aspect of religion. The two of those come together in a very challenging way in the aftermath of the Syrian war, which is still going on. It's not done, which still has all sorts of challenges going on. I want to add more challenges that are still happening and are going to go with us with this pandemic. Challenge number one. I should kind of go forwards and backwards. So yay, Syria it's not stabilizing. But let's say it's kind of stabilizing, meaning the bad guys winning against other bad guys. Why have I put up now the Syrian northern area of Idlib? Because in an area in northern Syria, we have, take a moment, it takes a moment to get this one here, we have Islamist fighters who are fighting against Bashar Assad. Some of these Islamist fighters are Muslim regular. Some of them are Muslim Al-Qaeda. Some of them are Muslim Islamic State. Some of them are supported by Turkey. And right now, what has happened is that some of them reconciled with Bashar Assad and went back to their homes. And right now, in the oddest turn of everything going on over the last month under this pandemic, Syria, or more correctly, Bashar Assad, has been sending Syrian former Islamic rebels to fight in Libya. And ladies and gentlemen, at the exact same time, Turkey is sending Turkish-backed Islamic fighters who have been fighting in Syria to fight in Libya. Only they're fighting on the two different sides. They're fighting against each other. That's happening now. Really? When we talk about the Middle East and North Africa, how many of us right now want to think about the fact that there's a whole additional failed state in addition to Syria, that it doesn't make Syria look good? For a moment, don't think that what's happening there is something positive, but it's going over to an additional new arena, and it has an enormous connection to Turkey. And I bring those all in because here we are, 2019, and Turkey today, in the saddest way, passed Iran with the most coronavirus people ill than Iran, meaning they've passed Iran, they're up on top of, it's gone very harsh inside Turkey. And here we are talking about Turkey and Libya and Turkey and Syria, and all of this is being impacted right now by this pandemic, which is going all over the place, of course, into places like Libya, but not stopping there. So I took you through different aspects of the pandemic. I need to focus for a moment on Israel's northern border. when I was looking at all of this aspect and I was asking myself as a question, so has this pandemic made it quieter for Israel on our borders, specifically our northern border, and in this case, the one where Hezbollah is on the other side? So two things. One, for around 10 minutes, yeah, it seemed like that. Hezbollah wanted to put itself as being at the forefront of look at what they're doing in the Hezbollah uniform. They're hugging the map and state of Lebanon. The health minister in Lebanon is from Hezbollah. The health issues are their responsibility. They're very much trying to show that they're taking care of the pandemic inside Lebanon. And over the last 72 hours, we have had both an attack that actually took place in Syria, but it was claimed to be by outer sources done by Israel again, by outer sources against Hezbollah. Hezbollah did a counter event on the Israeli border. Don't think that because of the pandemic, nothing's going on. Things are going on the Israeli-Lebanese border. Things are going on between Israel, Hezbollah, Israel, and all of these different proxy and independent forces that have built bases inside Syria. So it's like all of this was here before, and all of this is still here. Iran and its bases, and as I said, Iran exported, has supported, has been all out there. Great for them. Iran is the one that has exported. Just if you look at the amount of cases and you look at the amount of recovered, but the amount of deaths are very high up and by far the highest in the Middle East. So I go from all of my broad outside of where we are in the Middle East, where we are with these different cases, the different driving forces and how they dive into the aspect of the pandemic and what's going to happen the day after, and I come to us. So I'm skipping over this one. You can't see anything anyways. And I'm coming to Israel. Because here we are in Israel, 9 million people. And if you look at the map itself, I like to define and to separate between what I call, this isn't a political aspect, it's just to be clear in the way that Israelis view this, between what I call outer lines, which are the border lines between Israel and Lebanon, Syria, Jordan, and Egypt. Those are our outer lines. And between what I call inner lines, and that's the border, not border, between Israel and Judea and Samaria, the West Bank, and between Israel and the Gaza Strip. It's a different way of looking at it geopolitically. And I say that because when it came to the pandemic, the outer lines are totally disconnected, but the inner lines are connected just like they are in day-to-day life. And what does that mean? It means that Israel, by the way, I don't know how many of you can actually see this on the screen. Am I allowed to do just a minute of my sense of humor, okay? There I was looking for all of the data about Israel and the Middle East, and what I showed you before is that Israel is actually not part of the Eastern Mediterranean when it comes to the World Health Organization. If you look at the list of all of the countries, and for me to be able to see it on my screen, because I can't see anything right now, it goes Afghanistan, Bahrain, Djibouti, Egypt, Iran, Iraq, Jordan, Kuwait, Lebanon, Libya, Morocco, occupied Palestinian territory, Oman, Pakistan, Qatar, Saudi Arabia, Somalia, Sudan, Syria, Tunisia, UAE, and Yemen. And I'm looking at that and going, what about us? We don't exist. And I discovered that the World Health Organization in the Eastern Mediterranean region does not include Israel. And we're in the WHO, World Health, in the European region. And if you look on the map itself, and you see that in the middle of the map, I don't know if you guys can actually see my mouse right now, but the funny looking kind of, I looked at it and it reminded me of a seahorse, because it's in the Mediterranean Sea, surrounded by all of the white. That is Israel on the World Health Organization map of Europe. And you can see here that we're inside the 53 countries that they count inside Europe. Israel is green, which means that we're actually in good shape, that we're already keep cutting down the numbers of the pandemic itself. But when you look at that, you don't think of us that way. How does everybody think of us? They think of us not just through Israel and the deaths. I took this down this morning. I have a feeling that sadly there's already additional deaths. They look at us through the aspect of the occupied Palestinian territory, in the words of the World Health Organization. And here, and I'm going to end and open it up to whatever questions you'd like, the There are over, you can see 322 confirmed. This is from April 19th. It's from yesterday morning, yesterday evening, the last one that I took, 322. And of the 322, no question that over 100, meaning a third, were Palestinian workers who came from Israel and brought it into the West Bank. Inside the Gaza Strip, which is on the side, they have a lot less numbers. But when we look at that, state of Palestine, deaths 3, recovered 71. I'll give it to you in these terms, okay? Do we look at this right now as the United Nations, and they're not known for these type of news. The United Nations on their website 3 days ago, the UN envoy hails strong Israel-Palestine cooperation, meaning we're working together on health issues, talking about doctors, talking about supplies, talking about medicines, and you go down one. Palestine's economy hit by the pandemic, by Israeli occupation. Keep on going down, Israel's blockade has kept the worst of the virus out of Gaza, but it might keep aid out too. Just look at the way in that sense that the virus itself is presented through the same old patterns of Israeli-Palestinian issues, looking at it through the eyes of the occupation. From the Israeli perspective, we're helping. From the international perspective, we may be helping, but it's occupation. From the Palestinian or Arab perspective, overwhelmingly, it's about the occupation. So I don't think of myself right now as having anything to say. When I was looking on how I was going to finish, I wanted something nice. And I thought, does this help to go towards that peace kind of world? Is the Middle East right now going to be overwhelmingly impacted by the aspect of Ramadan, that month, because who knows what that month is going to do? It's not a day, it's not 2 days, it's not a week, it's a full month. At the end of the day, I'm in the Middle East. And I want to remind you that the borders that you can't see on this map, there are physical walls in and around some of the Middle East. There are fences in and around, but it's very challenging to be able to keep things out. I think that the driving forces that were here before February are the driving forces that are going to continue to impact what happens. Sadly, I think that the negative ones may be stronger than the positive ones, but I'm always a person of hope, and I want to hope that there would be more cooperation, not less, that we would look at this as something that we would handle and do together. And let's put it this way, my hope is that maybe we'll bring about some kind of solution, probably, anything good against this virus, and that will be something that will better both the Middle East and the entire world. So I've said lots and lots and lots of things. I haven't been able to be looking at the chat at the same time that I was doing everything else. I'm going for a moment to stop sharing so that I can see chat, okay? And feel free now, if you'd like to chat and send me any kind of question, please feel free. And if you'd like to raise a hand and ask a question, I think that can also be done.
Yes, definitely.
Okay.
So guys, first of all, thank you, Miri, for this really interesting. It's easy, but it's in a way it was also disturbing a bit, if I may say. It's resonate with so many things for me as a person, but I'm quite sure that for the others with us as well. Many questions could be raised. Guys, if you have any question for Miri, this is the time. If someone wants to ask, he or she can raise the hand or write on the right hand side of the chat. Otherwise, I may have a question for you.
Okay, I see Steele has her hand raised. Steele, would you like to ask?
Yeah, I wanted to know, is there any practice going on vis-a-vis cooperation with the Palestinian Authority and or Gaza that can, maybe you can do something optimistic, hopefully, about some cooperation and collaboration around the coronavirus, which may lead us to healthier cooperation in the future?
Absolutely. It's a wonderful question, and I'll say the following, that there absolutely is cooperation, certainly with the Palestinian Authority in the West Bank. Now, we do not cooperate with the Hamas leadership, but we do cooperate with civil society. We've done so for the last 13 years in the Gaza Strip. And what that means is that Israel did transfer some help to the Gaza Strip. It's much more complicated when it comes to the Gaza Strip. However, lots of international organizations that want to help the Gaza Strip do so through the Egyptian side. They don't need to come through the Israeli side. They have an alternative. When I talk about the West Bank, when I talk about the Palestinian Authority, areas A, B, and C, Israeli doctors and Israeli hospitals have worked very closely with Palestinian doctors, Palestinian hospitals, explaining how to do. We have lots more. We have, we're already past, tens of thousands. I mean, what are we now at 13,000 people sick? How you do it, what you do in different ways, in supplies and in every way. So there's absolutely cooperation. Then you get to the flip side. And I'm not saying this because I'm happy about that. I'm glad that it's there, that it has to do with the framing of how you look at it. Because for the average Palestinian, cooperating with Israel is a negative thing. So the Palestinian Authority cooperates with Israel, but their narrative, what they are going to say, their rhetoric is going to be totally against it. It's going to be about the occupation. It's going to be about the challenges. It's going to be about the fact that a third of their ill or because they were coming from Israel and Israel isn't doing enough. So I'm going to separate right now between the actual cooperation, mainly on the medical front, which is done through the coordination of the, it's COGAT, the coordinator of the government activities in Judea and Samaria, that does that coordination, that is very active and works, and between any rhetoric that you are going to hear from the leaders in the Palestinian Authority, let alone Hamas. Okay.
Thank you. There we have a few more questions. Miri, can you see, or would you like me to read, or?
Okay, I see it in that sense, so I'm gonna answer Ze'ev in a sec, just because I see in that sense that he said it's not negative, it's inflammatory, and I'm gonna say I'm gonna agree. Having said that, it's no different from what's always there, which doesn't make me happy, okay? I'm just saying it isn't that it suddenly became more inflammatory now than it was in the past. This is their frame. It's all about the occupation. It's always our fault. And for years now, we've been following the horrific, very inflammatory type of rhetoric that comes out of there. That's part of the challenge, but again, that's the same old, same old. Is it a cause for unification in the Middle East in my eyes? So here I want to say something in its own way about what I only discovered in the last 3 weeks as I was following the Middle Eastern aspect. I never knew that in the World Health Organization, Israel is in Europe. And the rest of the Mediterranean or Eastern region, from Morocco to Afghanistan, is under, meaning they didn't put us in the same group. Just look at that. So it might be unifying for all of the other countries, but I'm going to answer in an economic way. And I hope you'll abide with mine for a moment. Israel economically is like an island. We do not have trade with Lebanon, with Syria, or with Jordan and Egypt that we have peace treaties with. We're like an island. Our economy goes like island countries, like Australia, if anybody now online, or from England. Everything has to go out by boat or by plane. That's the way you get out. And that does impact the aspect of the virus, both in cooperating and otherwise. So I think that there can be quiet cooperation. I certainly think that Israel, that is at the forefront of medicine, of the medical aspect, is going to be part of the world that's going to bring out and help. So I really do hope in that way that that could be something, but it isn't better than that. And in that same way, if I look at the cooperation between countries in the Middle East, one of the things that I found is absolutely the opposite. What has happened, not just here, by the way, in the Middle East, I think of this as much broader. Have you all noticed how the world has closed its doors? Suddenly you have to be in your country and you can't leave inside your country, and every country has closed the door to the country next to them, including in Europe and in the Schengen countries and wherever. They all closed their borders. Same has happened in the Middle East. Countries became very closed in. Jordan closed itself off. Saudi Arabia closed itself off. Everybody wanted to close themselves off so that that's not cooperating. And that's part of the challenge as it's there. About the virus being weaponized. You know, guys, there are lots of other more horrific viruses that have already been weaponized. Don't want to make any of you feel worse, but biological weapons were not invented in the pandemic of 2020. They actually used biological weapons in the 19th century already. This is not something new. You can take all sorts of disgusting illnesses and keep them inside So sadly, it isn't that this one is going to be weaponized. That's a horrific thought. We're all thinking about it, but that's something that's already there, and it's not necessarily new. When it comes to Israel being part of the World Health Organization in Europe, hey, we all know that we're part of the Eurovision because we keep winning it, right? Okay. We're also part of Europe when it comes to soccer. Part of it has to do with the fact that Israel is not accepted into any of the Middle Eastern organizations. And more challenging for me as an Israeli is that we're not accepted into the Asian countries, meaning it isn't just Middle East. The Middle Eastern countries are in Asia, and we're not even accepted in Asia, and that's part of our challenge. As I said, I just found the World Health Organization map. It amused me because we look like a teeny little seahorse down at the bottom of, I just find, you know, got to have a sense of humor about something. So that would be, I think I answered most of the questions that I saw there. Yes, I saw the ones that were in the chat. And I think in that sense, Einav, you tell me if we have any more time.
I think we can spare I don't know, a few more minutes if you have something to add, Miri, or if you want to wrap up, or if any of you wants to ask one more question before we are leaving for this evening.
Okay, I don't see any more questions. Einav, you wanted to ask one or not? If I'm like,
No, it's fine.
Okay, so I'm going to offer two thoughts. And I offer them to you as Miri, as somebody who has been both in the military for most of my adult life, kind of, you know, segueing through that policy world, whereas I like to put it, I got to be the fly on the wall. I was not the one making policy, I was the fly on the wall. And I was the fly on the wall when they were making policy about things that they had literally years to prepare for. I can be very, very critical of all of the responses everywhere. I can want everybody to go, wow. These are not things that if you prepare yourself for a pandemic, you're not doing something else. If you would have invested in all of the things that needed to be done for the pandemic, it means you weren't doing something else. And I'm not saying this as good or bad. I'm just saying I'm very critical, but I'm also not the policymaker, and I like to give respect where respect is due. But my last one has to do with terminology and the way that we look at things. Think about it in the following way. We're all waiting for it to go back to normal. So everybody who's listening right now, normal is not what was here February 2020. When I say normal, one of the terms that I detest in Hebrew terms is the term in Hebrew, it's להשיב המצב לקדמותו, which is a very military term, which is the first thing that you want to do in the military, which means you want to first, once you've been attacked, you want to put the enemy forces back to the situation they were in before. There is no such thing. The situation of the summer of 2020 is not something that I can really assess because it isn't going to be like it was before. The change, the shift of what this has done is way beyond the regular other shifts. And because of that, I gave you some of the elements of the driving forces in the Middle East, the demographics, the religious self-identity, the aftermath of the Syrian war, which still continues, Islamic State and others, because I'm looking backwards at what was there, that's still going to be there, but I find it very challenging to be able to say what will happen this summer, let alone next year. And on that pretty realistic, hopefully not too pessimistic note, I'd just like to say thank you for listening, for taking the time, for Enav for hosting us. I'm a very proud member of the Dvorah Forum, of the Deborah Forum. I think that both in Israel and worldwide, there's one thing that we've seen in this pandemic has been world women leaders, in my opinion, have done a lot better than other leaders around the world. And I want to hope that we have more women in the room in decision making. Thank you all very, very much.
Thank you. Thank you very much, Miri. And I think that we all can only agree with you. For the future, let me just say that we still don't know when we will have the next lecture, but I urge you to follow the notifications. And I'm saying again, this lecture was recorded and it will be sent over to all of you guys through the social media of the organizations that are part of this collaboration. If any of you is interested in getting in touch and ask Miri questions, and I from what I know, I guess you see she's nodding, so you can do it through Tanya, and then again Miri can also share her slideshow. Thank you guys, and have a, I would like to say pleasant evening, but we are the evening of the Shoah, so I would just hope that we'll have a quiet and calm evening among us. Thank you.
Absolutely.
And,
thank you, Enav. I really should say, in Israel now, we're starting Erev Yom HaShoah. It's the Holocaust Memorial Day. So we should have a strong memory in our hearts. Toda rabba lekulam.
Thank you.
Thank you.
Bye-bye.
להתראות.
Later.